high.
Well, hello. Well, greetings, stoners, Satanists, queers, mushroom foragers, and other cosmic delights that are currently stranded on planet Earth. 2 weeks ago, Fox News' Tucker Carlson Tonight featured guest Bob Capano. Capano was on to address the growing heroin and opioid epidemic in America. Bob Capano is a professor of law at the John Jay College of Criminal Justice, is currently running for a seat on the New York City Council, and crowning his achievements, demonstrated on air how little he knows about drug policy reform, the very topic he was brought on to discuss. Now, since Fox News would never invite an ignorant guest on any show just to make a cheap political point, many of us were left scratching our heads in bewilderment. Now, this video is not meant to encourage anyone to use heroin or opioids in any way. However, Carlson and Capano made so many mistakes, and dare I say, premeditated mistruths, that I feel the need to correct them before they send drug policy reform back to the dark ages. So let's just get right into it.
There's a heroin and opioid epidemic underway in the United States. According to the Centers for Disease Control, the most recent data from 2014 show that opioids were involved in nearly 29,000 deaths. Opioid overdoses have quadrupled since 2000. Some argue there should be supervised injection facilities for heroin addicts so they can shoot up safely and avoid ODs and spreading disease.
Now, what Carlson didn't tell you is that according to the Center for Disease Control and Prevention, the very source that he cited, the majority of those deaths are not caused by illegal heroin injection, but by legal prescription opioid use, like oxycodone and hydrocodone. You see, first there is a misrepresentation of the matter at hand. That's why the banner read heroin-related deaths instead of opioid-related deaths. That misrepresentation can now be funneled into the matter at hand, namely New York City Council's desire to look into the possibility of free needle exchange clinics and clean injection facilities, the very City Council that Capano wants a seat on.
I mean, think about it. How can we expect law enforcement to prosecute drug crimes when City Hall is encouraging its use?
City Hall is not encouraging people to use heroin. That would be like saying building homeless shelters will encourage poverty. No, what City Hall is trying to do is come up with a new solution to a problem for which traditional solutions have not worked.
We don't even need to guess what would happen because Zurich, Switzerland tried this in the 80s. 1987, a park right in the middle of Zurich allowed a free heroin injection space with needles subsidized by the government. In 5 years, there were 20,000 heroin addicts living in downtown Zurich, and they shut it down because it was a disaster. Are they not aware of that?
So this is a little odd because nothing Carlson said is technically untrue. However, he did leave out so much of the story so as to skirt a very thin line between ignorance and a lie. Here's what really happened in Zurich in the late 80s. This was during the AIDS outbreak that was occurring in Western civilization, the late 80s. So these needle exchange programs were set up not to reduce the number of heroin users, but to reduce the number of HIV/AIDS carriers. It had been noticed by researchers that 50% of heroin users were also infected with HIV/AIDS. So these programs were set up to give clean needles to reduce the number. In that sense, the program was very successful. The number of heroin-using HIV carriers went from 50% to 5%. However, an unforeseen consequence of all this were the so-called needle parks that formed, and Carlson is 100% correct about that. That kind of program was a disaster and did have to be shut down. Now, that's where Carlson ends the story, but that's not where the story ends. What happened was in 1993, after the parks were shut down, these researchers went back to the drawing boards and came up with new strategies to implement. These new strategies included, first and foremost, not allowing junkies to bring heroin into the facilities nor take it out. They also were allowed to inject the heroin in the facilities so that it'd be clean, and they would be overseen by doctors and other healthcare professionals. This time it worked, and by 1999, Parliament extended this kind of needle exchange and clean injection facility from Zurich to all of Switzerland. So the full story is a needle exchange program was tried. It was a disaster. They fixed the problems that led it to be a disaster, and lo and behold, it was a success. Now, Capano doesn't know any of this, or he doesn't want you to know any of this, and that's why he is going to redirect to Vancouver, Canada.
I guess not. I mean, in downtown East Side, Vancouver, Canada, they have this Insight program, and that was the first place in North America that opened. And if you look at downtown East Side, Vancouver, we have people lining up on the streets begging for money so they could bring their heroin in there to legally shoot up and get high.
Except that Insight has the support of such prestigious medical journals like The Lancet, the Canadian Medical Association Journal, the British Medical Journal, and the New England Journal of Medicine, to say nothing of the support it receives from the BC government, the local police, and local medical care professionals. And why? Because all of them have watched Insight work. From 2004 to 2010, there were 1,418 overdoses that occurred inside the facility. Of that number, the amount of people that actually died, 0. Not one. So I don't think Bob Capano knows what he's talking about, because both the medical associations and the government agencies all say that Insight lowers crime. They say that it lowers the spread of disease, and it lowers the number of overall deaths due to overdose. Now, for some reason, Bob Capano wants to pretend that that's all bad for New York? Right.
I mean, to me, this is just bad for the taxpayers. This is bad for New York City, and it's even worse for addicts.
Well, those are all just lies. So the Canadian Medical Association Journal did a cost-benefit analysis of Insight. Turns out that Insight saves the Vancouver taxpayer $20 million annually, so strike one. Bad for New York? Really? Lowering crime? Lowering overdose death? Lowering the spread of disease is bad for New York? Someone's going to have to explain that one to me. Strike two. And 3, it's bad for the addict? Well, like I said before, from 2004 to 2010, of the 1,400 overdoses that occurred at places like Insight, well, there were 0 deaths. So what is Capano talking about here? You'd almost think that he didn't know anything about this topic at all and was really just arguing from the standpoint of having a political motive.
Like, call me crazy, but if any money is being used on this issue, it should be used to break the addict's addiction to the drug.
Okay, you're crazy. But to get back to your larger point, and it is a very good point that we should be focused on breaking the addiction of the user, well, as it turns out, we actually have some pretty good ways of doing that. But you're probably not going to like them because they involve using entheogens, like ayahuasca. Ayahuasca has been used successfully to help people break such everyday habits like smoking cigarettes and watching too much television to more dangerous things like heroin addiction. The good thing about ayahuasca is that it's safe. It is not addicting in any way. It also has a very good track record of success. But this is the best part. If you were to get behind this idea, Bob, you could open up the first ayahuasca clinic in New York and call it Ayahuascapano.
Because when you tolerate something, you get more of it, as any parent of teenagers can tell you.
Except it doesn't matter what parents or teenagers think about any of this. It matters what scientists, criminologists, the police, public health experts, other researchers think. It matters what they have to say about it. Okay? And they were all probably watching that segment with Carlson and Capano, unsure whether they should be laughing or crying. The New York City Council merely wishes to implement strategies that have already shown to be successful in Switzerland and Vancouver. Chris Behrer, who is not exactly a teenager, but he is the president of the International AIDS Society and is also the director of the Johns Hopkins Center for Public Health and Human Rights, has this to say, quote, "The evidence is overwhelming that needle syringe exchange and safe injection facilities work, save lives, are cost-effective, and prevent new infections." The jury is in, and Capano is standing outside the courthouse picking his nose with Tucker Carlson. Needle exchange and clean injection facilities save lives, save taxes, reduce crime, reduce death, and reduce disease. All of those things would probably be very great for New York, so I don't understand how Capano could get up there and run for a city council of a city that he clearly doesn't like very much because he doesn't want to help solve the problem. Anyway, thank you all so much for watching this. That's all I have to say on the topic, and until next time, peace.
Oh, good evening and welcome to Tucker Carlson Tonight, the show that is the sworn enemy of lying, pomposity, smugness, and groupthink.